Hi, I'm Dr. Carolina Jimenez, licensed psychologist specializing in immigration evaluations. I work with people seeking asylum, with people who have survived domestic abuse, violent crime, or who are seeking a hardship waiver for their loved ones. Today, I want to talk to you about some barriers for mental health access, specifically within the Hispanic or the Spanish-speaking population in the United States. The first barrier would be cost. A lot of the times to work with a highly experienced, highly trained professional, depending on their education level, it could be anywhere between $120 to $250. So this includes master's level therapists like licensed professional counselors, social workers, psychologists, or psychiatrists. So price could be a big barrier. Fortunately, if you are living in Houston, Texas, where I'm headquartered, we do have a lot of nonprofit organizations, community clinics, and training programs within university counseling centers where you can seek services at a reduced price. The second barrier would be accessibility, like how close is it to my house? Do I have transportation? Do I feel comfortable driving on the freeway? So fortunately, we are using technology for our benefit. So there's a lot of mental health professionals who offer services online. The third barrier would be stigma. So unfortunately, there's still a lot of people who feel uncomfortable seeking professional help because they're afraid they will be judged. They're afraid they will be misunderstood. So again, just keep in mind, this is another tool, another resource that you have available for your health and well-being. If we can look at mental health, not that there's something wrong with us, there's something defective within me, but this is a part of my well-being. This is a part that I could enhance. This is something that if I take care of, could benefit other areas of my health, then our attitudes and our behavior when seeking mental health services could help. So oftentimes people who have depression may experience higher propensity for diabetes or hypertension or high blood pressure. So keeping in mind that if you take care of one aspect of your health, you could benefit in a different aspect of your health, can make a whole difference. Another factor could be not knowing where to seek the best fit for you. For example, I will feel more comfortable working with a woman. I do want someone who speaks Spanish. I want someone who's familiar with Hispanic culture. So we do have several online directories where you can do a search based on your criteria. We have psychologytoday.com, goodtherapy.org, and the openpathcollective.org. So there you can go online, search for people close to you, within your price range, within your zip code, and any other criteria that you would like. And then finally, lack of awareness. So oftentimes we're not sure that something could be a symptom or a signal that our mental health might be suffering. For example, we might think we're just stressed out, we're anxious. We look for any other reason to explain why we're behaving or feeling a certain way, when it could be an indication that maybe you are feeling anxiety. So for example, be mindful of the way you usually interact, your habits, your patterns, your behavior. And if there's anything outside of that, be open to exploring what that could mean. For example, if you like to wake up early, if you're a morning bird, and all of a sudden you find yourself sleeping in till 11 a.m. and it's hard to get out of bed, that could mean there might be some depression going on. If you're usually very patient, very easygoing, and then you find yourself being impatient, irritable, not wanting to be around people, that could be an indication that you might prefer to be socially isolating, and that's a symptom that you're either anxious or depressed. So don't just look at one symptom, look at the entire behavior and how that might be changing, and pay attention to it. It might be time to do a consultation with a mental health professional. Just because you go once doesn't mean you have to keep going. Just like anything else within your health, some people have annual medical exams for their general health. It would be a good idea to do an annual mental health checkup. So if you want more tips, more specific information, feel free to leave me a comment and I'll be happy to do that. Have a great week and follow me on social media. I'm on Twitter, Instagram, and Facebook. Dr. Carolina Jimenez, licensed psychologist. Thank you.